Hello friends, let's see the anatomy of the abdominal aorta. This abdominal aorta begins as the continuation of the descending thoracic aorta at the aortic opening of the diaphragm. So this is the opening of the abdominal aorta, which lies at the level of the lower border of the T12 vertebrae. The aorta passes downward in front of the vertebral column and to the left side of the inferior vena cava, and going to end by dividing into right and the left common iliac arteries at the level of the L4 vertebrae. So this is the end point of the aorta, which lies at the level of the lower border of L4 vertebrae. And the ending point of the aorta, it is slightly left to the median plane. When we see the measurement of the abdominal aorta, it is around 10 to 12 centimeter in length, and it is around 2 centimeter in the breadth. When we see the topography of the abdominal aorta, it is represented by the two parallel lines around 2 centimeter apart. The beginning of the aorta, it corresponds to a point about 2.5 centimeter above the transpyloric plane. So here this is the transpyloric plane, which lies at the level of the L1 vertebrae. So around 2.5 centimeter above this transpyloric plane, the origin point of the abdominal aorta lies, while the ending point of this abdominal aorta, it lies around 1 centimeter below the level of the umbilicus in the anterior abdominal wall. Now let's see the relations of the abdominal aorta. When we see the anterior relation of the abdominal aorta, these are the main three arterial trunks which are going to arise from the ventral aspect of the abdominal aorta, and these are the celiac trunk at the level of the lower border of the T12 vertebrae, superior mesenteric artery which lies at the level of the lower border of L1 vertebrae, and the inferior mesenteric artery which lies at the level of the L3 vertebrae. Along with the celiac trunk, there lies the celiac plexus of the nerves around the celiac trunk, and these are also lying in front of the abdominal aorta. The celiac trunk, it is compressed by the papillary process of the liver from above and the tuber omentale of the pancreas from below. The origin of the superior mesenteric artery, it is compressed above by the splenic vein and below by the left renal vein, and so both these structures also lies in front of the abdominal aorta. The origin of the inferior mesenteric artery, it is crossed by the third part of the duodenum, and that's why this third part of the duodenum, it also lies anterior to the abdominal aorta. And this whole abdominal aorta, it is retroperitoneal, so that's why it is covered by the peritoneal covering. When we see the posterior relations of this abdominal aorta, we can appreciate that there are 4 lumbar vertebrae along with their intervertebral disc and their anterior longitudinal ligament. So all these structures, they lie posterior to this abdominal aorta. Along with this, the 4 lumbar arteries, these are going to arise from the dorsal aspect of the aorta. They are also lies behind the abdominal aorta. So here these are the lumbar arteries. Along with that, the left psoas major muscle, it also lies posterior to the abdominal aorta. When we see the right relation of the abdominal aorta, we can appreciate that inferior vena cava, which lies right to this abdominal aorta, and in the upper part of the abdominal aorta, from where it is going to continue from the aortic opening of the diaphragm, there lies 2 important structures on the right to this abdominal aorta, and these are the thoracic duct and the azygos vein. thoracic duct, it is the continuation of the cisterna chyli. And along with all these structures on the right side, we also find this right crush of the diaphragm to the right of the abdominal aorta. When we see the left relation of the abdominal aorta, we can appreciate that on the left side we find the left crush of the diaphragm, and along with that we also find the left sympathetic trunk, as well as on the left side of the abdominal aorta we find the duodenojejunal junction. In the lower part of the abdominal aorta we find the inferior mesenteric artery also lying left to the abdominal aorta. So all these are the important relations of the abdominal aorta. Now let's see the branches of the abdominal aorta. When we see the branches of the abdominal aorta, we can appreciate this abdominal aorta having 4 types of the branches, and these branches include the branches from the ventral aspect, branches from the lateral aspect, branches from the dorsal aspect, and the terminal branches. The ventral branches of the abdominal aorta, it includes the 3 major arteries, and these are the celiac trunk at the level of the T12 vertebrae, superior mesenteric artery which lies at the level of the L1 vertebrae, and the inferior mesenteric artery at the level of the L3 vertebrae. All these 3 ventral branches, they are the unpaired arteries, and they are the arteries of the foregut, midgut and hindgut respectively. When we see the lateral branches of the abdominal aorta, these all are the paired arteries, and the first artery of the lateral branch of the abdominal aorta, it is the inferior phrenic artery, and this inferior phrenic artery is going to supply the inferior aspect of the diaphragm. The second lateral branch of the abdominal aorta, it is this middle suprarenal artery, and this artery is going to supply the suprarenal gland. The upper suprarenal artery is a branch of inferior phrenic artery, and the lower suprarenal artery, it is a branch of the renal artery. The larger lateral branch of the abdominal aorta are the renal arteries, which are going to supply the kidneys. And just below the renal artery we find one more lateral branch, and this lateral branch, it is the gonadal branch, which is a testicular artery in case of male and the ovarian artery in case of the female. When we see the dorsal branches of the abdominal aorta, we find there are 4 lumbar arteries, and for the better understanding of these lumbar arteries, let's remove this nomenclature of the superior and the inferior mesenteric artery. So here these are the first lumbar, second lumbar, third lumbar and the fourth lumbar arteries, which are going to arise from the dorsal aspect of the abdominal aorta. And one more dorsal artery which is going to arise at just above the ending point of the abdominal aorta, and this artery, it is the median sacral artery. And at the end, the 2 terminal branches of the abdominal aorta are the right and the left common iliac arteries. So this is all about the abdominal aorta. Hope you understand well. Thanks for watching.